Hi, everyone. Thank you very much for joining us for this week's Facebook Live conversation. This week, we are going to be discussing healthcare resources during COVID-19. We are joined by Ashley Starr-Frechette, who is CCADV's Director of Healthcare Resources, Ted Doolittle, who is Connecticut State State Healthcare Advocate, and Kate McAvoy, who is Director of the Health Services Division at the Department of Social Services. Kate, did I get that right?
You did, yes, thanks.
Okay. Wonderful. So we're just going to turn it over to Robin just to do a little quick housekeeping, and then we'll get started with the conversation.
Hi, everyone. Good afternoon. Thank you for joining us. My name is Robin, and I will be the moderator of this afternoon's conversation. We are broadcasting this from our Zoom meeting and also Zoom meeting platform and also on Facebook Live. So for the participants that are here on Zoom, please feel free to open up your chat feature on the right-hand side and please field any of your questions, comments, concerns into that window. I will be moderating that, watching it as we continue throughout the discussion, and we'll be happy to get your questions, concerns, and comments to today's panelists. And then I'll also be keeping an eye on our Facebook Live. Thanks.
All right, Ashley.
All right, well, thank you so much for having us today. Thank you, Kate and Ted, very much for joining us. I'm really excited to talk with both of you. So basically, I was trying to get an idea of some of the health insurance resources and updates that you guys might have for survivors and victims across the state. With the COVID-19 pandemic, it's more important than ever to know what insurance resources are out there and to have health insurance to improve overall health. But many times it can be very daunting and it's hard to understand where to go and what's covered, etc. So we're hoping that you guys could help us shed a little light on some of the resources that are available to individuals across the state so they can get the health insurance resources that they might need to live healthy and productive lives. So thank you very much. Our first two questions are for Kate. So Kate, I was wondering, with the COVID-19, we've seen a lot of job loss as a result, including families who experience domestic violence. So what kind of programs does DSS have to help those who are coping with that financial impact of unemployment?
So Ashley, Liza, Robin, thank you so much for the opportunity to join you this afternoon. I really appreciate this question. And the first thing that I want to say is that we've seen over 530,000 people in Connecticut file claims for unemployment. You are not alone in this experience if you're facing unemployment or if you've been furloughed from employment and are facing constraints on the money you need to live. The Department of Social Services has really made every effort to make it easy to access the benefits that we offer to people who maybe need a financial support. We have really a one-stop access point for the Department of Social Services. If you log on to our website, Department of Social Services, and you click on the Connect link, that will take you to an application form that covers all of the types of benefits that we offer. We do have programs of income assistance for people who have very low or no income. We also, as you may be aware, are the Medicaid and Children's Health Insurance Program agency for the state of Connecticut. And we're acutely aware that healthcare costs are not manageable, especially for those who are unemployed. So the Husky Health Program is a major source of economic support. Over 850,000 people are participating in that program in Connecticut currently. We also administer the SNAP program, Supplemental Nutrition Benefits for people, again, who have low income and need some assistance in purchasing food. The SNAP program has been expanded during the purposes of the public health emergency to cover additional families and to wrap around the benefits that children would have received through meal programs in school. So these are just a few examples of the way we can be of direct assistance. The single best way to access this, as I said, is to use that online application form. You may also contact us. The phone number is listed right on the website, but the fastest way to get help is to use that form.
Thank you so much. And you kind of already touched on this, but if there are any other programs or expansions that you guys have implemented in response to COVID-19, I know you mentioned SNAP, but are there any other expansions or extensions, and where do those stand now that we're kind of a little bit reopening, stuff like that?
Yeah, great question. So we took many actions at DSS to help respond to people's needs during the public health emergency. First and foremost, we have held off on any change in people's benefits, and that's across the board. That's for food assistance, for income supports, for the Husky Health Program. We basically maintained everyone on eligibility, so you didn't have to be concerned that you might lose eligibility during a period that's already very tough for everybody involved. We have also, in Husky Health, expanded the array of benefits that we cover and created new ways for people to be served in non-traditional manner that allowed people to stay at home and not go directly to see their medical providers in the community. So let me just mention a couple of those. We did fully cover and are continuing to cover testing and treatment for all Husky Health members for COVID with no coinsurance. I have to say that very plainly. Testing and treatment for COVID is fully covered for all Husky Health members, both Medicaid and CHIP folks. So if you have concerns or symptoms, you have only to pursue a conversation with your primary care provider to start accessing treatment and to get testing. We also have enabled many Husky Health services to be offered through what's called telemedicine. Telemedicine is either video conferencing with your healthcare provider, or in many cases, just a typical phone call. We covered the great majority of our medical services, also a broad range of behavioral health services and some therapies. And we did this so that people did not have to put themselves at risk of exposure to COVID and could essentially contact their doctors remotely for a whole range of types of services, both diagnostic and in some cases receiving the service actually remotely, like a behavioral health consultation. We have also extended our pharmacy benefits. So people who are on Husky Health can access 90-day supplies of their prescription medication. Again, the idea is that you don't have to be going out to the drugstore to have those prescriptions refilled on a periodic basis. And we've also taken a lot of actions to make it easier to serve people who are affected by COVID. We have supported nursing homes and private primary care providers and other providers in the community with enhanced Medicaid funding so that they can essentially accommodate all the costs of doing business in this tough environment. So again, a lot with Husky Health. SNAP has been expanded, and I think our overall approach has tried to be really trying to be as accessible as possible. Again, using those entry points that I described, the universal application is the best way to get the assistance, and we're continuing to partner with the state health insurance exchange, Access Health, to smooth all the pathways for getting health insurance. So please don't feel like you have to know what you qualify for with respect to health insurance. All you have to do is access one online application through Access Health, and that will inform you what you qualify for. So again, Ashley, thank you for that question. And if there are further questions from those who are watching, we're very happy to answer those.
Thank you very much. Yeah, that's all really helpful resources. And I think it's important what you said, that don't feel like, if you don't think you apply, just try to apply and see what you're eligible for. So thank you, I appreciate that. If we don't have any questions, I'll go next to Ted. So Ted, I was wondering, what can people do who have lost their medical insurance, possibly due to unemployment because of COVID-19? Are there resources that they can access?
Yeah, absolutely. Thanks for the question, Ashley, and I appreciate the invitation to join CCADV here. Obviously, we have a tremendous amount of respect for your organization. I've tried to partner with you guys over the years, so thank you very much. You know, obviously folks are losing their jobs, and with that often comes a loss of insurance. First, let me introduce the Office of the Healthcare Advocate. I do call it often the best kept secret in state government. The reason is because it's almost unique. Connecticut's really almost the only state that has this type of state agency. And we have a staff of nurses, attorneys, paralegals, and others who are dedicated to helping people who are having trouble with their health coverage. So they can have a claim denied and they confused about how to appeal. We can either coach them through that, or if they sign the correct releases, we can even represent them just the way a private attorney would do, except our nurses, attorneys, and paralegals work for the state. They work for you for free. So any type of health insurance issue you can bring to us. And by health insurance, I do mean it broadly. Any way you get your health coverage, be it Medicare, be it Medicaid Husky, veterans, even a healthcare sharing ministry, one of the alternative coverage plans, any type of hassle you're having or challenge you're having with your health insurance company or health coverage, we can assign a case manager to help you. We also, and this is the most important part for our conversation today, we also provide advice and counsel for people who are negotiating what to do when they've lost coverage or when they're shopping for coverage. We do that in partnership with Kate's organization, DSS, the Medicaid Husky organization, and also with Access Health that Kate mentioned, which is really, if you go to the website and you go through the application process, they will check for eligibility for a variety of programs, not just the ACA subsidies, but also membership in Husky for yourself or for your kids. But the main buckets of ways to think about if you're facing a loss of coverage, I'll run through some stuff, and please pardon me if I look down at my notes. The first thing, really the best coverage out there, is see if you can get to Kate, because Husky is terrific coverage that is virtually free. So you should check to see whether the two main avenues are going directly to DSS. Kate's mentioned the website, or going to Access Health and going through their process, which will also tell you whether you or one of your children might be independently eligible for Husky, even if you're not. So it's important to do that. It's also important to think about, people think of Husky Medicaid. Remember that the Medicare expansion the Medicaid expansion, in recent years has really moved eligibility up into the really middle class, and you'd be surprised. I think the top of the eligibility for Medicaid Husky for a family of four is something on the order of $83,000. Kids in that type of family might be eligible for that. So don't despair that you might not be covered or eligible for Husky, but that is stop one to think about, to see if you or your kids qualify for free coverage on Husky. The second thing to think about is continuing with your job-based insurance. That's called Cobra. People are pretty familiar with it. That's available if you had coverage through your job. Now, the sticker shock is usually pretty extreme there, because people don't know that if they have job-based insurance, they see the premium that they're paying. Little do they know that their employer is usually paying 3, 4, or even 5 times as much for their coverage. We as employees don't see that on the paycheck, but when you go onto Cobra, the employer is no longer obligated to pay that. You have to pick up their side as well. That's why Cobra is a very, very expensive option. However, it's America, so it's complicated, and you really have to be on your toes. And one of the things you need to think about is, if you're on a job-based plan, what is the deductible, and how far along in the deductible are you? Because even if the premiums are very expensive, if you have qualified now into the insurance, you've made it through the deductible, even if the premiums are expensive, it might be overall cheaper for you to stay in that Cobra plan rather than moving to a plan with lesser premiums, but now you have to work off a whole new deductible. So Cobra is the second main thing to think about. The other thing is to move to the plan of a spouse or partner, or if you're under 26, a parent. And those folks might have insurance through their jobs. They also might have bought insurance on the exchange themselves. Anyway, if your spouse, partner, or if you're under 26 parent has insurance, you may have a right to join their plan. Now that's gonna result in their premiums going up, of course, but you may again have a right. It could be an option that you really need to check out. The other main avenue that you should explore is buying your own insurance, whether it's through the marketplace, the Obamacare, the ACA, Access Health, those are all synonymous, whether buying your own insurance on the exchange. In some cases, there are plans that are sold off the exchange that for certain families might be cheaper. So one of the things you may want to do on the Access Health site when you're exploring their options there is to take them up on their offer to direct you to an insurance broker, certified broker, and they can assess your options both on the exchange, or for certain families, you might be cheaper off, better off buying a plan directly from an insurance company or through a broker off the marketplace. So quite confusing. The other main option, people probably would know if they're eligible for this one, but just to run through it, is of course Medicare. If you're 65 or approaching 65, or you're on dialysis, or you have certain other limited disabilities, you may qualify for Medicare. So those are the main buckets, Ashley, to think about when you're looking for health coverage. I should mention also, though, if for whatever reason you're uninsured, or you can't qualify, or you can't afford any of these other programs, there is some still developing, and I can't give all the nuances of it, but they're still developing some federally backed programs for uninsured people to receive COVID-19 testing and treatment that is reimbursed. If you go to the hospitals will take care of you for free, and then they will apply to Washington, D.C. to get reimbursed for the funding. So even if none of these options are open to you, if it's a COVID-related issue, there may be some sanity there for you. There may be some programs for you. You should usually, I think, contact your hospitals. Those are all being developed, and I'm not, I can't give you all the details on those since it's so new, but the hospital should have more information if you contact them directly about that option. Those are the main options, Ashley.
Thank you so much. That's really helpful information. I appreciate that. And actually, you both kind of answered within your answers, kind of touched on what insurances are actually covering when it comes to COVID-19. So I appreciate that as well. That was my next question. If either of you have anything to add to that as to what insurances are actually now covering when it relates to COVID-19, please let me know. But if not, I can move on to the next question.
Yeah, actually, I'll circle around and just reinforce. Husky, like I said earlier, covers all testing and treatment for people who qualify for Medicaid and CHIP. We have recently rolled out 2 new coverage options in Husky. One is for uninsured individuals of any income. So I'll say that one more time. Uninsured individuals of any income can be covered for testing for COVID. So that's a helpful means of actually getting that out-of-pocket cost covered. It would not cover the treatment, and that's where you'd have to look to one of the options that Ted outlined. Separately, the state of Connecticut has interpreted long-standing coverage in Medicaid called emergency Medicaid coverage. We have newly interpreted that to permit us to cover testing and treatment for people whose immigration status means that they cannot qualify for Husky Health. They have not lived in the United States for 5 years or more, or they're not in a category that's recognized as qualified for Medicaid under federal law. So if you're a person who has that type of immigration challenge, please know that you can receive coverage from DSS for both testing and treatment for COVID. We want to make sure that people are not left without coverage at this time. And we're one of a number of states that have made this new interpretation. Again, the best place to access either of these coverage groups is, again, going to our website, Connecticut Department of Social Services. There is a specific section of the webpage that relates to our work during COVID. And there is an area of that webpage that covers and provides links to the applications for this benefit. So we encourage you, if you do not otherwise qualify for Husky Health, keep those two options in mind also.
Thank you.
And actually, if I can just add as well, in terms of what is covered, folks should know that the insurance commissioner in Connecticut announced last month that under the fully insured plans, which is the type of plan the state has jurisdiction over, to make it very simple, under those state jurisdiction plans called fully insured plans, there will be no out-of-pocket cost for testing as well as for treatment. Now, the federally controlled plans, which are called self-funded plans, they have made a commitment to waive the out-of-pocket expenses for testing. And the insurance commissioner of Connecticut, with my wholehearted support, has urged those self-funded plans to also waive the out-of-pocket payments for the treatment. But that's just state officials urging the plans to do so. Those are really federal requirements. So in terms of what is actually covered, right now we're in a pretty good universe that I frankly couldn't have imagined we'd be in on, say, February 15th or so. There's been a lot of effort. Now, people are getting tripped up, and we do get cases of people who have co-pays that they don't understand. And that's a perfect example. You know, you're getting a bill for COVID, yet you're insured and you don't know what the deal is. That's a perfect example of somebody that should be coming to the Office of the Healthcare Advocate and getting one of our case managers engaged to help them work through that.
Great, thank you. That's really helpful. I was just going to ask that in case someone does get something like that. So thank you, appreciate that. And thank you, Kate, for all that information. It's really helpful. So next question, this one's for Kate. So in general, I've heard you talk a lot about this at the State House, but I was just hoping if you could let people know, for victims and survivors that might not know, what are some resources that DSS has just in general that they might not have been aware of, like transportation or other resources that are kind of intertwined in your areas?
Yeah, Ashley, thank you for that question. I first want to say that you know, we care deeply about people who've had this experience. I know there's often an incredible amount of urgency in terms of people's needs. They're complex. People have complex circumstances associated with where they're going to live, how they're going to, you know, keep themselves employed and fed. And for those reasons, all the programs that I mentioned are really important resources for people who have experienced domestic violence. Within them, I think there are a range of resources that are important to know about. Husky Health, as Ted mentioned, we cover a comprehensive array of medical, behavioral health, dental, and also non-emergency medical transportation. We are unarguably the most comprehensive health insurance in Connecticut. You know, most private insurance doesn't cover anywhere near the behavioral health support or the transportation that we cover. So people should know that if they become a Husky Health member, there is a broad range of services that can immediately wrap around you for those purposes. We can help you connect with medical providers. We have a fantastic network of primary care, both for medical providers and behavioral health. People often have a myth and misconception that providers don't take Husky, and we've been very fortunate to encourage and seen many providers have joined our program over recent years. So there is availability in our network. We're also a program that uses just one set of standards and one approach statewide. So you don't have to figure out, as is the case in some other states, what a managed care plan is covering and what is not being covered. If you join Husky Health, it's one plan for the whole state. So those resources are part of your entitlement for Husky. Over and above that, we have two organizations that work with us, CHNCT and Beacon. Respectively, these organizations are what we call administrative services organizations, and they provide a lot of additional supports to members. They can help you find healthcare providers. They can provide what we call intensive care management. They help support the process of identifying needs beyond the programs that are administered by Department of Social Services. So if someone has a very complex situation, is emerging from a situation of domestic violence and looking to start afresh, especially where that concerns safety and confidentiality, looking to create a new life. The intensive care management through both CHN, CT, and Beacon can really be a lifesaver in helping support you with a team approach, not only for your health needs, but for your other needs, including housing. I'll just wind up by saying that we partner with myriad community-based organizations in Connecticut. This coalition just being one example. And so we also have a lot of contracts through DSS for services that can be of great value to people who have faced domestic violence, including, for just one example, the community action agencies. They manage fuel assistance and also other programs that address critical needs for people. So I think bottom line is we have a lot to offer. We try very hard to make it simple to get help in the same way that I discussed in terms of applying for benefits. We have just 1-800 number that you can use to connect with CHN on medical issues, just 1-800 number that you use to connect with Beacon for behavioral health matters. We really do try to say, if you just know that number, you can get a whole range of help and support.
Thank you so much. That's really helpful information. I appreciate that. And I guess the next question I have is back to you, Ted. I was wondering if you could give us a little bit more information about the resources that are available to victims and survivors through the special enrollment period, or the SEP.
So the special enrollment periods are times when you can enroll in the exchange. The normal enrollment period starts in November for the next year. Special enrollment periods can occur if people have a life change, which could include marriage or divorce. Moving is a life change. However, I think that because Connecticut's such a small state, people are not typically going to be eligible for a special enrollment period if they move within the state. I could be wrong about that. But the special enrollment periods are something to be aware of. One of the special enrollment periods is triggered by, if you do lose your coverage, you then have a 60-day special enrollment period to go on to Access Health. Obviously, folks who are subject to domestic abuse might have one of those events more likely than the regular population. So hopefully there will be a way. We can always, if you want advice about whether you're eligible for a special enrollment period, please contact us at the Office of the Healthcare Advocate. We do have, we serve all types of clients, but we certainly have had clients who are experiencing domestic violence, and we understand the even more than normal confidentiality requirements around that, and we'll look forward to treating your case with the discretion that is required.
Thank you, I appreciate that, because I know it can be kind of confusing when you see like, oh, the state's open enrollment period is only during a certain amount of time. So just to know that there's options to get coverage depending on what your situation is helpful. So thank you. You both answered the question about what to do if they had anything that they wanted to dispute about COVID. Ted, you kind of touched on that earlier, so I'll just skip over that, and then I'm going to open up the question to both of you. I was wondering, what rights do victims and survivors have when they're accessing programs or assistance from either of your agencies? And what are your agencies doing to make sure that those rights are supported, making sure, obviously they feel like their confidentiality is being taken care of and stuff like that?
Sure. Well, I'll go ahead and start. We handle people's personal information and medical information all the time. We're highly aware of the sensitivity of that. We have ongoing training about that, and that is a priority at the Office of the Healthcare Advocate. Sometimes people, will approach one of our case managers. Hey, my friend has a case with you. How's it going? Well, the answer they're going to get back is, I'm not going to discuss. I'm not even going to confirm whether your friend is a client of ours. That's what the confidentiality level is at OHA. And again, we are sensitive to and extraordinarily supportive of the folks that are engaged in domestic violence challenges, and we want to be there for you. And we have several. All of our case managers can handle the cases, but we have several in particular that have developed an expertise in these types of delicate situations.
Thank you very much. Kate?
Yeah, so I'll wrap around up by saying that we also hold those types of confidences that people share with us and their personal information very sacred. There are legal obligations and also ethical obligations that attach to that are paramount for everyone who works at DSS. I do want to say over and above that, we have formally adopted an approach that says that all the folks whom we serve, we must do so in a person-centered manner. What do we mean by that? We must be motivated by your goals and your preferences. We're not here to make your priorities for you. You may want to start by addressing one aspect of your life and really work through that prior to moving on other pieces. And we look to you to help us understand in what specific way we can be of support. Additionally, all the folks that are involved in the intensive management that I described that is available through our medical and behavioral health ASOs have very specific training in how to help connect with people on when it can be a very difficult interaction. We understand that people are sharing extraordinarily private details of their lives. That can be extremely emotional and taxing. Even the effort of speaking forthrightly about what has happened to you may just feel overwhelming. But those intensive care management folks have a lot of experience in this. And in the case of the Beacon teams, also they have included in their care teams people with lived experience with behavioral health conditions and also substance abuse. If that may be an issue for you and you feel, my gosh, no one could understand my experience, it'd be very difficult to talk to someone and feel like I might be being judged, I can assure you that you are not alone in those experiences and that there are people who share that, they've walked that walk, they're in process of recovery themselves. So I hope you feel a sense of trust and confidence that you would not be subject to someone who does not understand your situation and would be unsympathetic or dismissive. We're here to help.
Thank you so much. That's really helpful. I appreciate that. And before we go, I just wanted to open up the floor to both of you to see if there were any other final resources or information that you wanted to promote about either of your programs. And also, if you can just reiterate where they can find those resources, I think especially that intensive information, and then obviously OHA's information as well.
Okay, great. I'll go ahead and start. So I would like to draw people's attention to the fact that OHA has just put up on its website in the past week or so a pretty comprehensive review of the options for folks who have lost their insurance. So I'll mention our website, which is ct.gov/OHA. That's ct.gov/OHA, OHA, ct.gov/OHA. And right in the middle of our page, you'll see a question, lost your coverage, and more information and resources. And it's set up, I think, in a very thoughtful, layered way. You go to a bullet, it tells you, you know, Cobra is an option, and then you click on Cobra, a paragraph comes up, and if you want to go to an even more detailed document, you click and you go to a comprehensive document. So it's set up from most simple to most detailed, and you should be able to find your level of what you need there. We also direct you out to reliable resources outside of our website that also have put up things on the web that might be helpful for folks who are looking for their coverage options. You can contact us through that website, ct.gov/OHA. You can always call our toll-free number, which I'll give 2 times. It's 866-466-4446. That's 866-466-4446. Or you can always email us at healthcare.advocate@ct.gov. That's healthcare.advocate@ct.gov. And again, if you go to our website, ct.gov/OHA, you will find a link to all these materials that I've been summarizing in this talk about your options if you've lost your coverage.
Thank you so much. That's really helpful. I appreciate that. And Liza did add them to the chat box for anyone to click on. So thank you very much. Kate, any other resources?
Sure. So again, we try to make it as simple as possible and as least a burden on people who are looking for help as possible. So again, if you have not previously applied for benefits through the Department of Social Services, the main web link to do so is connect.ct.gov, G-O-V, connect.ct.gov. You can do almost all of the application process online, including uploading any documents that we need. And you can also establish your own account so that you can monitor the progress that you make in terms of being approved for benefits. So again, connect.ct.gov if you need benefits and haven't received them previously. If you are looking for information on your Husky Health benefits, which, like I said, is very comprehensive, and sometimes people don't realize how much coverage they have under the Husky Health program. The website, all you do is type Husky Health CT, and that's going to bring you to a member website that has a whole range of resources. For instance, you can look up participating Husky Health providers in where you live. It'll give you a geographic map that shows you exactly where they're located and their contact information. You can access quick guides that describe what we cover in the program very helpfully, so you have immediate knowledge of the types of services that you qualify for. There are links to our behavioral health coverage, our dental coverage, and our non-emergency medical transportation. There are also a lot of health resources. There are resources on various chronic conditions and prevention. There's resources you can use to track your health status. There is a whole set of resources on cultural competency that we have put in for our providers. So if you're a person who has a language other than English as your language of origin, you're from another culture, we are really making a lot of effort to help make sure that the Husky Health providers can respect your needs and can accommodate them linguistically and otherwise. And I want to say it's very important to us that you feel that you are respected in that process and you have the ability to have your needs heard and met. So again, 2 sites, really the Connect site if you're applying for benefits, the Husky Health site if you have a question about benefits that you receive. And again, there's a wealth of resources on both sites that you can browse through that may provide further information that you would find helpful.
Well, thank you so much. Thank you both, Ted and Kate. I really appreciate it. I think this was really helpful. And I don't know if there was any questions, Liza, but I just want to thank you guys both again. This is really helpful information.
It was my pleasure. Thanks for having me.
Yeah, thank you so much. We really appreciate that you're doing this. And if we can be of support ongoing, please let us know.
Thank you very much. I appreciate it.
All right, Robin, so we didn't have any questions from the audience?
Nope, there's nothing in Facebook Live. We have a lot of attendees and people sharing, but it seems like they don't really have much to say about this particular topic.
Right.
So if we do, we'll let you know.
Yeah, absolutely. And we appreciate you guys being an ongoing resource. You guys are,
Thank you.
both of your organizations are of huge assistance to victims and survivors. So we really appreciate everything you do. So we will get ready to close out. As always, I just like to share our contact information for anyone who does need help. If you're a victim of survivor or even a friend or family member who thinks you know someone who might be experiencing an abusive relationship, please reach out to us. CT Safe Connect is Connecticut's domestic violence resource hub. That's how you access services here in Connecticut. Just kind of a one-stop immediate response and triage to needs. And then they will make that safe connection for you out to your local CCADV member organization who provides that ongoing support and services. Oh, too quick. You can reach Safe Connect 24/7, 365 days a year. Safe Connect, CCADV, and all 18 of our member organizations are fully operational throughout COVID-19. So we are here if you need us. So you can reach advocates again 24/7 via call, text, chat, or email at ctsafeconnect.org or call or text 888-774-2900. Bilingual services are available. These are our wonderful 18 member organizations across the state. So again, no matter where you are in Connecticut, we have someone ready and able to assist. Again, thank you very much for joining us today. If you have any questions about the presentation, you can always reach out to Ashley, who's our Director of Health Professional Outreach. Her email is right there. Please follow us on Facebook, Twitter, and Instagram, and we hope to see you next week. Thanks very much. Bye, everyone.
Thanks again.
Thank you.
Thanks, Kate and Ted.
Welcome. Thanks so much.
Bye.
Thank you.